Buenas tardes. Good afternoon and welcome. I will be speaking in Spanish, mainly because my presentation is a very exciting presentation, and in English or in French, it would be more difficult for me to communicate everything that we have done and everything that we have achieved. Firstly, I would like to thank Alzheimer Europe for organizing this wonderful and great conference, and I would also like to thank CIAFA for counting on the IMSERSO department from the Health Ministry and also for counting on the Foundation Alzheimer's Spain. It is a great honor to share this panel with experts of this quality. So thank you very much. I would also like to thank everybody here. I would like to say hello to the Portuguese representatives and all the other countries, and for the ACE Foundation, the Pascual Maragall Foundation, and all the other foundations. We are very close to some of these foundations, and I would also like to welcome all those foundations we work with throughout the European networks. And I would like to mention something that I believe is very clear, and that is the importance of social healthcare investigation for Alzheimer's disease. Dear psychiatrists and neurologists and doctors, until we don't reach the point of curing the disease, we need to be working with all our healthcare partners, because it's important to have these worlds connecting and working hand in hand throughout networks, because that's how Alzheimer's Europe and Alzheimer's International is working. This is the most important aspect. Why is it important to have this social healthcare investigation in dementia? Well, when we are working in the area of psychosocial aspects, we can improve our assistance and care, and we can also improve all the interventions for the people with dementia and their carers and families. And in this way, we develop new intervention models and new therapies that are non-drug therapies and that refer to all psychosocial and social health interventions that have been implemented for other conditions. And the goal is for research to provide new resources that we didn't have before, because we are going to be working with partners who will not just be the occupational therapists or the psychologists, but also the neurologists and the psychiatrists and other specialties that need to be working together. That's the key point. Additionally, it's important to be working with the new IT technologies, communication technologies, and all this is absolutely key, because in this way we can create, and as the General Director of IMSERSO just also mentioned, we have this Spanish national plan for Alzheimer's with the development of specific policies, and the goal is to find global solutions for treating Alzheimer's and other types of dementia. And which areas of research am I referring to? Not just non-drug alternatives. We know that the drug therapies should go hand in hand with the non-drug therapies, and we also need specific training for carers and the family of people of dementia. And we need also success predictive factors, because no matter how many interventions we have, what's important is to know which ones are successful. We need to know which types of interventions do work well with those people with dementia and their carers and family. We need to know which are those that will be efficient. Therefore, we need these predictive factors, and we also need to know what the outcomes will be. And the outcomes will not be the same for all people with dementia. Everybody is different. Therefore, we need this personalized type of approach that's based on ethics and psychology and neurology and social aspects. And then we also need to develop protocols, because we have no protocols for the research. We all work according to our own protocols, but there is no clear methodology with a systematic observational method that enables us to determine the efficacy and the efficiency of all the interventions. We need the resources to improve, thanks to the fact that the social healthcare research works together with the clinical research. And then we have the assistance technologies and all the strategies for training carers and healthcare professionals, because very often we see that it's not just the people with dementia who have a problem, but also their carers. It's their carers who also develop conditions. And what happens with the outcome criteria? Because we have many different multidisciplinary teams, and we don't have the same outcome measures. It would be important to have the same outcome measures, because each group, each professional is applying a different outcome measure. And this means that we need to coordinate all these resources so that through research we can reach a consensus and do the same. Additionally, we need to look at the cultural and ethical values, and also all the aspects associated with the stigma of this disease. And additionally, we need to look at the associated economic costs that are very high for those involved. And we also need to look at the ethics and the rights that my friend Mercè Boada always speaks about in CEAFA. What are the main barriers? Well, firstly, it's difficult to have a social health care research. It's not easy to do this type of research because the nature of these people with dementia is heterogeneous and progressive. The disease is not always the same, even if you have two people with dementia at the same stage of the disease, and therefore we cannot apply the same type of intervention. Additionally, we have small samples. How can we increase the number of samples? Well, with an open science approach. We should all be working in networks, collecting samples and applying, of course, the data protection law. And in this way, we would be able to have more homogeneous samples, because when the samples are so heterogeneous, it's difficult to work in the social health care field. We also have another barrier, that is the difficulty between the control group, the placebo group, and the therapy group, because you either give a tablet or you don't. That's the easiest example we can give. However, here, someone who's listening to music or participating in a therapy with music, then musical therapy is also associated with this research. It's not entertainment, it's research. And there are many other types of therapies of this kind. And then we also have difficulties with the double-blind studies, because in other clinical studies, it's very clear that the assessor doesn't know who they are assessing. And this is something we can still do. We can have a blind assessor. However, someone with a mild dementia will know whether something is applied or not, because the non-drug therapy is obvious and visible. One can see if the person is stimulated or not. In our research field, therefore, we do find these barriers. Additionally, the interventions are not well defined. They are implemented, and we always hear that there are different types of therapy, robot-assisted therapy with dogs, with musical therapy, dance therapy. However, the definition of these sessions with a systematic observation doesn't really exist. Are there any intervention protocols? I don't really think they always exist, because there is also a lack of appropriate tools that help us measure each case indicator per indicator. Furthermore, what is the main ingredient or of any tablet? You have ibuprofen and other drugs, and we know what their main ingredients are. But what happens with non-drug therapies? Does anybody know? You can never define that main ingredient. If it's music, is it communication? Is it the healthcare professional? Is it the therapist? Is it your peer? And we don't know the dose either. What is the right dose when you do this type of therapy? When it's a clinical study, it's easy to measure that. When you are investigating vaccines, for example, we know what is the right dose, the exact dose, but that's not the case with this other type of research with non-drug therapies. And which are the challenges that we're facing if we really want to work together in this social, clinical, and healthcare research? Firstly, we need evidence-based interventions. We cannot call something a therapy when it's not. It may be deemed as a therapy if there is a systematic observation, where there is a methodology, when we have accreditation standards, because they do exist for project management, and when there is an efficacy and efficiency and effectivity. When we define what we want to achieve, when we see the cost-benefit relationship, and then we can see if that therapy is efficient, if that intervention is efficient. That is the challenge. If the intervention that we're going to implement and the research have a positive outcome, we need to know the cost and if it's going to have some benefit or whether it's just confirming our hypothesis. That's why we need multidisciplinary teams with all social healthcare professionals involved. We need to focus research through specific tools, and we all need to try and use the same tools. And as we were saying before about open science, we need to work in network. Very often we're afraid of sharing information, really, really afraid. And what's important is that all of us can share the information that we have and not just keep it for ourselves. And at our department at the CRE, that's the State Reference Center that belongs to the Health Ministry and to the IMSERSO department. And for 10 years, it's managing knowledge and it's disseminating knowledge. It has some very clear objectives. It creates expert networks and provides assessment. We have two centers in one. We know that for research we have the universities and we have the clinics, and we put them all together. We have our own projects. We cooperate with foundations and universities. We have many of these institutions here represented today. We assess the projects, and we have new research projects with new intervention models, robot therapy, and many other therapies in cooperation with many foundations. And we also have European programs that enable us to open up science and work with other fields, such as the neurodegenerative field. And the idea is to work all together. And with this, I will end. When did we decide that all this type of research, the clinical research and the social healthcare research, should go together? Well, that was back in 2011 with the Reina Sofia Foundation, the Pascual Maragall Foundation, and the Health Ministry and the Economy Ministry. We decided that it was important to work all together, and we also had this Lisbon summit in 2017 that reconfirmed that these two types of research, clinical research and social healthcare research, should work together. So that's all. Thank you very much for your attention, and that's all. Thank you.
Muchas gracias.